questionnaire. If I were to print off one of those and perhaps see you again in a few weeks, would you be able to fill that in for me, do you think, and bring it back? Because what I'm thinking is perhaps if we started without some tablets, if you're happy with that, I could also arrange for you to see our practice counsellor as well as coming back to see me, and then perhaps we can use the questionnaire as a way of charting your progress. Do you know what causes depression?
No.
No. I mean, would it be helpful if we spoke a little bit about what might be making you feel like this, do you think?
Yeah, what do you mean, other than my job?
Well, the job is certainly one thing and can generate some stress, and obviously it's difficult balancing a job and having two young children and things as well. But there is a school of thought that suggests that sometimes it's the chemical levels in the body, if you like, that are a little bit out of sync as well.
Yeah, because I do feel just I can't do anything, I can't play with the children, and it is an effort to just get up off the couch sometimes.
Right. I mean, I'm not necessarily suggesting that we would have to give you some tablets, but I think it's perhaps useful just to reassure you that there's a reason why you're feeling like this, and it's not just, that everything is, you're not behaving appropriately with everything else going on.
Yeah.
But the other thing, of course, is work, and if work is the problem, I mean, do you think it might be useful to have a few days away from work to sort of think about what's going on, perhaps look at the questionnaire and have a bit of a time space, if you like, before you go back?
It would certainly, yeah, I think it would help, because as I say, I've got a review next week, and I know my manager's just, I know it's going to be awful, he's not sympathetic, and I know I'm not up to date with things.
The only thing I was just thinking about is with your review next week, if we put you off work for a few days, how would that affect your review? I wouldn't be putting you under more pressure at work, would I?
No, I'd quite like to have a break if you're sort of suggesting that I could not go in for a few days.
Well, I mean, I would suggest, why don't we think about giving you a couple of weeks out? I know that sounds quite a long time, but it might be an opportunity for us to get you to see the counsellor here a couple of times, do the questionnaire for me that we've talked about, and then maybe come back and see me in 10 days or so.
Yeah.
We can see how you're doing, and then maybe think about getting you back to work in the next week. But it would give you some breathing space over the period of the appraisal, I suppose.
Yeah.
Does that sound reasonable?
Yeah, that would be good.
And the other thing is that obviously your husband's involved in this as well, and perhaps your husband might like to come in and we could talk with him as well if you think that would be helpful.
Yeah, I think he'd come along because he's quite worried about me, and he did say to come here, so I think counselling might be quite good, actually.
Right. Have you got other friends that perhaps have been through stress at work or anything like that?
I don't think so. I've tended to sort of lost touch. I haven't seen them for a few months, and they've said come out, but I don't really want to see them at the moment, really.
Right, okay.
Come in. Hello. Please take a seat, Mr. Middleton. I'm sorry about the confusion.
Yeah, well, I'm a bit sorry. I'm rather busy at the moment. I'm very busy.
Sorry.
I've been out there 45 minutes waiting. Yeah, my normal surgery. I go in there. All I want is a prescription, repeat prescription.
Sorry.
And I've been getting all this hassle. Then you're on coffee breaks and...
I'm sorry,
anyway,
I'm Dr. Galbraith. You're here now. How can I help now?
Well, I've only come about. I've got this itchy problem. Normally, as I say, my other doctor just gives me a repeat prescription, and as I say, all this hanging around, and I'm not too happy about it, to be honest with you, but what I need is something for this itch. I'll sort of get this stuff out of my hands and my arms.
Okay. And how long have you been having it for?
Well, I've had it now for probably a few years now. But,
okay. And you say your last doctor gave you a repeat prescription?
That's right, I'll get a repeat prescription. I have some tablets which I'll take, but I don't think they do much good, to be honest with you.
Right, what tablets are they?
Begin with the cetirizine, is that?
Cetirizine?
Yeah,
they're an antihistamine.
That's correct, yeah.
Okay, and is that what you wanted on repeat today?
Well, I thought maybe I'd had that, but I thought if we'd had a bit more time, you'd have been on time.
No, that's fine.
Maybe
we may as well talk and see, because it might be if they're not working, we can find something else for you.
Okay, I'm on some cream as well.
Okay.
I don't think it does a lot of good, to be honest with you. I'll get it on the legs here too.
Right, and it's itchy, and you feel itchy all over?
Yeah, I get itchy and just annoying. Yeah, it comes up with a bit of a rash.
So, okay, so you do get a rash?
I do get a rash, yeah.
Okay, and is there any time of day you notice it's more itchy, if you've been in the shower?
Not particularly, no. It comes up as and when. I don't know if it's allergy related or not, but I don't think so. But
yeah, not
this is what I wanted to see about, to be honest with you.
Yeah, sure. Okay, so you've had it for a few years, you've tried the cetirizine and you've tried a cream. Can you remember what the cream was?
It's Diprobase, is it? Diprobase,
okay.
Hodjo.
Does that help?
Yeah. I don't think it does. I put it on from time to time, but I don't use it regularly probably because I don't feel it does much.
Okay. And had you any thoughts about what might be causing this?
Not really. So I was hoping you'd perhaps be able to throw some light. The other doctors sort of used to give me the repeat prescription, but I thought maybe we might be able to delve into it a bit more. But
because you mentioned allergies, is there any allergy?
Not that I know of. This is maybe I thought we could perhaps sort this out today, but as I say,
I know we've obviously kept you. Do you want to talk about it now?
Well, I would have done had you been on time, and I was a bit surprised. I mean, I've been waiting there. I don't want to go on about it. I'm not normally an angry person, but the fact is, the secretary out there didn't really see it giving much of an apology and didn't bother about it. Just the fact I thought maybe doctors might even keep an eye on their own sorts of waiting rooms. But I mean, I've got a job to do, same as you have, and I've got to get off in a minute.
Well, why don't we just very quickly see if we can get to the bottom of it, and if we can't, then we'll have to get you to come back again. But if you've got a few minutes, we'll talk about it now.
Yeah, it has to be very quick because I've got the
worried about allergies.
Yeah.
You were saying the cetirizine doesn't help, the Diprobase doesn't help.
I don't think it does.
Sometimes you get a rash, and there's no particular time that it comes up.
Not really, it comes up as and when. I don't think it comes up at any particular time.
And you've never had any investigations?
No, not really. The other doctor just used to sort of give me the repeat prescription, as if, there it is, but that's probably what I asked for.
Yeah, well, that's why, because you're a new patient, we're a bit reluctant to put something on repeat without knowing exactly why, so I apologise for that, but that is the reason.
To be honest with you, I was angry when I came in the door and I did want to make a complaint, but okay, I do accept your apologies. I'm not a reasonable person, okay?
If you want to make a complaint, that's fine too.
Yeah, okay.
Is there anything for me to see at the moment?
Well, you can maybe see little aspects of it. I'll get this dryness up the arms and...
Okay, so it's a dry skin.
Yeah, I'll get it, I'll show you.
Okay.
You see all that sort of around there.
Is there anything on your elbows?
I can probably just get that up.
Okay, I can't see anything. And nothing behind your knees?
It's usually down the front of my legs, down that area.
Okay, and you've never suffered with eczema, psoriasis?
No.
And are you usually fit and well?
Yeah, generally I've got quite good health, no problems.
Okay. Not on any new medications? You didn't start any meds a few years ago?
No.
Okay. Not weeing lots, drinking lots?
Yeah, just normal, nothing else untoward, I wouldn't say.
Okay, not losing weight, anything like that?
No.
Okay, often there's no cause for an itch. I think if your skin is very dry, like yours appears to be, especially on your hands and arms, that can make you itching.
Right.
It's a case of finding something that suits you. If the Diprobase hasn't worked, there are other creams we can try that you can use as soap and also as a moisturiser afterwards. And you can put them on as often as you want. And the more often you put them on, actually, sometimes the better it is.
Okay, well perhaps we'll try that then.
Yeah, I mean, I'm quite a fan of double base, but I don't know if there's any other ones you've heard of.
I haven't myself now, as I say, that's the ones that I've normally got on prescription and that's...
Would you prefer to try something different then? I think if the others aren't working...
Well, if you feel that, this is what I'm here for, to take your advice obviously on that, so...
The cetirizine's an antihistamine. If there is an allergy, then that's the reason for using that. Whether it is an allergy or it's just because it's dry skin, might be worth stopping the cetirizine. You could try a different tablet antihistamine to see if that helps.
Right.
Alternatively, try a different cream and see if we can get your skin less dry.
Whatever you suggest, I'm quite happy to try something else that you're suggesting.
Are you sure?
Yeah.
Is there anything else you were hoping we might be able to do?
Not really, no. Just as I say, I'm a very busy man. I just wanted to get this sorted quickly.
As it's a prescription for something new you haven't tried, I don't particularly want to put it on repeat because if you don't get on with it, we'll try something different.
Yeah, I understand.
Okay, it's double base is the one I quite like.
Okay.
You rub it on, much like the Diprobase. It's just a bit. It will leave you looking a bit more oily, but it sinks in throughout the day.
Okay. Okay.
You can put it on as often as you want, and I would use it. You can use it in the shower as well.
Okay.
You're not using any scented products in the bath?
No, no.
Okay. I'll give you a big tub with a pump dispenser. Okay, and did you want another prescription for the cetirizine or do you want to hold off those?
What would you suggest? I mean, I don't personally feel it does much, but there again, I only take it as and when I feel like I'll quite often forget it, to be honest with you.
You were worried that it was an allergy, and I think if it had been an allergy, then we might have been able to find the trigger by now.
Right.
It might, I think, as I said, it might be worth just stopping them, seeing if it is just to do with the fact your skin is extremely dry.
Okay. Maybe just use the cream for the time being. Okay.
How does that sound?
Yeah, if you...
To make sure you've
that.
understood that, can you just repeat back to me what we've discussed?
Yeah, well, we've discussed the fact that the itching comes up as and when, not at any particular time. I'm not sort of using any scented things. I don't feel I've got any allergies. We're going to give the tablets a miss for the time being, as we don't appear to be allergies, and then we're going to try a new cream, as I don't feel that the other cream is satisfactory in my case at the moment.
Why don't you give this cream sort of a couple of weeks to see if it works?
Okay.
If it doesn't help, pop back and we'll have another look. Alternatively, if you get any of the rash does appear, come and see us whilst you've got the rash, because then we can get more of an idea.
Okay.
Equally, perhaps if you still remain itchy all over, occasionally there can be a physical cause, and we might do some blood tests, but I think because it's been going on so long, it's unlikely to be that.
Right, okay.
Okay? You're not on any other medications that you need to be put on repeat?
No, just those.
Okay. Okay, there's a prescription for your double base.
Thank you.
Which is the big pump dispenser.
Yeah.
And as I said, use it as often as you can.
Okay.
Alright, and sorry again about the confusion.
Well, okay, I'll send you apology on this behalf. Hopefully it won't happen again. As I say, we've all got business to attend to. Is that okay?
Nice to meet you. Thank you, Mr.
Thank you very much, Doctor. Thank you. Bye-bye.
Come in.
Good day, Doctor.
Hello, Mr. Iso. Come and have a seat.
Okay.
Right, so what brings you to me today?
Sorry to bother you. I just need a note for the gym.
Oh, right, yeah. What sort of note?
Oh, my wife's been reading this fitness magazines, and she wants us to get fitter.
Oh, good. Yeah.
So I decided to join the gym.
Yes.
And the instructor says I should see you for a note.
Oh, okay. So what's the note for exactly? Because when we don't normally give notes.
Well, the note, well, he just said, see your GP to make sure I'm fit to use the gym.
Okay.
Yeah.
I mean, we haven't seen you very much over the past few years. You haven't really come in very much. Is there anything actually wrong with you then?
I'm okay. I'm well.
Feel well?
Yeah. I'm okay. The only thing I told the instructors, I went to Florida.
Oh yes.
Last year.
Yeah.
And I did one of his fat things, blood test.
Like you mean cholesterol, that sort of thing.
That's the one. Yes. I was told it was high.
Right.
Advised me then to see you, but I forgot about it really.
Right.
Sorry.
Okay.
Yeah, sorry.
Okay. So I mean, is that why the gym asked you to come and see me, because you said you had your cholesterol checked? It was high?
Maybe, but I feel well.
Right. Okay.
Yeah.
Well, I mean, I don't think we've done your cholesterol, have we? Or anything? I haven't got any records here.
No.
Well, I think I need to check your blood pressure first, and then maybe check you over. Is that okay?
Yeah.
Okay. Do you mind slipping your jacket off, and I'll do your blood pressure?
Thank you, doctor. Okay.
All right. Have a seat. And can you just roll your sleeve up?
Is that okay?
Oh, right. It's 150 over 90. That's So that's quite high actually. Well, I'll have a listen to your heart and chest now. Do you mind just putting everything up? Right. Okay, well, I've had a good listen to your chest and heart, and they sound fine. But your blood pressure really is quite high. It's 150 over 90, and our guidelines say that really that requires treatment. So I'm just wondering how you feel about tablets or anything like that.
Tablets? No,
Yeah.
No,
I mean,
feel okay myself.
right.
I need tablets.
What I mean is your blood pressure really could do with some treatment, and we could start some tablets now. I mean, I can see you're not used to taking tablets, so...
No.
Right. Well, I mean, we've got a range of tablets we could use, and I could start you on one today, but if you want to think it over, and, you know, we could bring you back another time and then just check it again and see if it's still high, start it then. You know, how do you feel about that?
Yeah, I'll do that one. I'll use the gym first and then come back.
Yeah, okay.
Yeah.
Because sometimes if you do some exercise, it could bring it down. So okay, right. Yeah, the note. Well, I mean, is it a private certificate that you're wanting? Because we normally make a charge. For
No,
that.
the instructor says I should see you.
Right.
You know, to make sure I'm fit to use the gym. That's all he told me, and I'm here.
Okay. Well, there's no reason why you shouldn't use the gym. I mean, using the
Okay.
gym is very good for you. It's I think it's a good
Yeah,
idea that you do lose a
yeah.
bit of weight and you know, get yourself fit and all that. So I mean, we say just go ahead and use the gym. That's fine.
Okay. So you give me a note then, yeah?
Well, I mean, we don't really have any sort of notes that we give for the gym. I suppose I could give you a private certificate, but we'd have to charge you for that. So, I mean, how do you feel about that?
Don't have money on me.
Well, you don't have any money on you?
No.
Right. Well, I could. What I could do is write your private certificate. I mean, it's just quite a small charge, and if you want to come and collect it afterwards when you've got some money, then you could take that to the gym if you want.
Okay. All right. Would that let me use the gym?
Yeah, I mean, you know, you're not. To be honest, you aren't really fully fit, and you know, we have got to get your blood pressure under control. And the other thing is we haven't done your cholesterol yet, and that's another worry for us. So shall I write out some blood test forms for your cholesterol then?
I'm a bit worried about that though,
Are
because
you?
it was heart problems.
Yeah.
I read in the magazine. You can get heart problems.
Well, I mean, yes, it is a factor, and I think with your blood pressure being high, it's just another thing to think about. So, yeah, I can't say that it isn't a risk for you. It is a risk for you, and we've got to make sure that's down, because if that's not down, then we've got to put you on another tablet.